different structures of a tooth and about the different varieties in a tooth. So first of all, when we talk about any tooth, the basic thing that we notice is the enamel. Enamel is the outermost covering in a tooth. When we look into our oral cavity or our mouth, we see that the white layer in our tooth that is covering, it's called the enamel. And depending on the translucency or the thickness of the enamel, the teeth can appear to be whitish or yellowish in color. So the basic thing about enamel is it's harder than even a bone. Bone is basically forming the basic skeleton of the body, so it's pretty interesting that it is harder than the bone. And enamel, it's like the basic constituents of bone are present even in the enamel. It consists of calcium and phosphorus. And the next layer of enamel is called the dentine. It is yellowish in appearance. So that's why when the enamel is thin, the color of the dentine is reflected and the tooth appears to be yellowish in color. And the next layer after the dentine is called the pulp. It is vascularized. Vascularized as in it is supplied by blood vessels. So it is extremely sensitive. So when the term sensitivity is mentioned or something about root canal treatment, it is this layer, the pulp, which is affected. So because it is highly vascularized, like I said, because of mastication is nothing but chewing, because of which the enamel could be corroded. And if the enamel is corroded, the dentine and pulp are extremely soft. They're not very hard like the enamel. So it will reach the pulp and it will affect the pulp, and because of which the sensitivity is experienced. So this layer here is called the enamel. Following the enamel is called the dentine, this entire layer. And after the dentine is the pulp. So this part is called the crown and this is called the root. And the crown is what is visible in our mouth. The root is not, because it is present within the gums. The pinkish layer that we see in our mouth, that is nothing but the gums or the gingiva. And surrounding the root is the cementum. Like the name suggests, cementum is a cementing material which attaches the root of the tooth to the surrounding bone. So cementum is surrounding the root, whereas the enamel is surrounding the crown. Hi, like I mentioned before, I'm going to be talking about the different varieties of tooth, and in our lifetime we have two sets of tooth, that is temporary and the temporary dentition is the one which sheds. So it's also called as the deciduous dentition, and the permanent one is the one which comes later in life. So the permanent dentition, there are many tooth that are not present before, that is in the deciduous dentition. So we talk about the permanent. This is a model right here where we can see, when we talk generally, we can divide into 4 quadrants, 1, 2, 3 and 4. That is 2 in the upper jaw and 2 in the lower jaw. So here, this is the midline. If you consider this to be the midline, this is the central incisors on both the sides. Central incisors, probably it was named central incisor because it's present right in the center. And the basic function, right next to the central incisor is a lateral incisor. So the basic function of these incisors is to bite. You bite with the help of these incisors. After the incisor is a canine. You can see that it is a little wedge shape. That is because it's used for tearing the food, canine. And after canine, it is first and the second premolar. And these two premolars are not present in the temporary dentition. And then after the first 2 premolars, there are 3 molars actually. But here there is first and the second molar, because the third molar is called the wisdom tooth, which comes later in life. When you're 18 or above 18, it comes later. So that's why here in this particular dentition, the wisdom tooth is not visible. So these molars that are present here, their basic function is to just chew the food, mastication, it helps in that. So in the deciduous dentition, the first 2 premolars and the third molar is absent. So here there are about 8 in the permanent. There is central, there is lateral, there's canine, first and second premolar, first 2 molars, and later in life the third molar comes. So there are about 8 tooth. So 8, there are about 32. But in permanent dentition, there are, like I said before, the first and the second premolar are absent, and the last, that is the third molar, is absent. So there are only about 5. That is the central, lateral, the canine, and the first and second molar are present. So there are about 5. So 5 and 5, there are 20 in temporary dentition. Thank you.